Pray for India should increase mental health budget to 5% from 1.05 percentage, and 3 psychiatrists per 1 lakh citizens. To enforce mental health as a fundamental right under Article 21, India must treat mental health as an emergency, and counseling must become a public infrastructure, not charity. For maximizing synergies, a strong interministerial coordination should happen, and every school, college, and district hospital, agrarian flag have a counsellor. Amen. This article comes in Hindu English daily newspaper Chennai edition on 10th October 2025. According to National Crime Record Bureau, accidental death and suicide in India 2023 report, there were 1,71,418 suicide in India, a rise of 0.3 from previous year. The Andaman and Nicobar Islands, Sikkim and Kerala reported the highest suicide rate, while Maharashtra, Tamil Nadu, Madhya Pradesh, Karnataka and West Bengal accounted for more than 40% of all deaths. Cities continued to have higher suicide rates than in rural India, reflecting the pressure of urban life. Men made up 72.8% of all victims, revealing gendered economic and social stress. Family problems accounted for nearly a third, 31.9% of suicides, followed by illness 19% and substance issue 7%, and relationship or marriage related issue about 10% combined. Suicide remains the leading cause of death amongst India's youth aged in 15 to 29 years, and the country bears a disproportionate share of global female suicide deaths. Untreated mental illness could cost India over $1 trillion in lost GDP by 2030. Employers already lost over 1.1 lakh crore annually to absenteeism, attrition and burnout. Each suicide, each breakdown is a silent voice, a broken family and future cut short. 80% of India's workforce reported mental health issue in the past year. India ranks highest global for burnout symptoms. 76% of Indian employees say they lack the time and energy to do their job effectively, a leading indicator of disengagement and innovation slowdown. India's mental health system needs attention. With just 0.75 psychiatrists for 1 lakh people, well below the World Health Organization minimum of 1.7 and far from ideal 3, besides a similar shortage of nurses, psychologists and social workers, care is scarce. Nearly 230 million Indians live with mental disorders, from depression and anxiety to bipolar and substance use conditions. Yet over 4 in 5 persons with severe illness receive no formal care due to stigma, the cost and a severe shortage of professionals. Lifetime prevalence sits at 10.6% with treatment gaps that range from 70 to 92%. Even as official suicide rates appear stable, the World Health Organization estimates 16.3 deaths per 1 lakh people, highlighting India's heavy mental health burden. Even though district mental health program has expanded its coverage, various studies report that district mental health program function poorly in various states across the country. Shortcoming extend to medicine availability as well, where often primary health centers report stockouts of essential psychotropic drugs, rehabilitation services vital for recovery and social integration meet less than 15% of identified needs nationwide. Deep-seated stigma continues to exist as recent studies indicate over 50% of Indians attribute mental illness to personal weakness or shame. In India, the workforce remains centered around urban specialist doctors. Rural populations, which constitute 70% of India's demographic, face severe scarcity of mental health professionals. In India, annual budget to mental health, it's only 1.05% in health budget. So India must undertake comprehensive policy reforms. The government should increase the mental health budget to at least 5% of the total health expenditure, facilitating infrastructure, workforce recruitment and medicine supply. Scaling mid-level provider training and deployment would ease urban-rural disparities and surpass the World Health Organization minimum workforce density. Full integration of mental health into primary health care and universal health insurance scheme should guarantee accessible and affordable care nationwide. India must treat mental health as an emergency, not as an afterthought. The government should prioritize mental health and establish a cross-ministerial task force that span health, education, agriculture and women and child welfare with independent funding and clear accountability. Within 5 years, the aim should be to have at least 3 to 5 mental health professionals for every 1 lakh people, achieved through expanded training, scholarship and incentives for rural postings. Counseling must become public infrastructure, not a charity. Every school, college, district, hospital and agrarian block should have a full-time trained counsellor or a direct link to one funded by central budgets. Should not be left to non-governmental organization or goodwill. Special outreach is needed for high-risk groups such as farmers, homemakers, students, survivors of abuse and caregivers. For farmers, counseling must go hand in hand with debt relief and livelihood support. Homemakers, often isolated, need community-based therapy networks. In coaching hubs such as Kota, mental health care must be continuous, institutional and preventive. To enforce mental health as a fundamental right under Article 21, so legally binding the government to ensure accessible, affordable, equally mental health care in India. Amen. Bible talks about mental health issue in India. Ecclesiastes chapter 7, also in 1 Samuel 25th chapter 36 and 37. Surely oppression makes the wise man mad. And Abigail came to Nabal, and behold, he held a feast in his house, like the feast of a king. And Nabal's heart was merry within him, for he was very drunken. Wherefore she told him nothing less or more until the morning light. But it came to pass in the morning, when the wine was gone out of Nabal, and his wife had told him these things, that his heart died within him and became as a stone.